Good evening, guys, and welcome to part 3 of Defeating Domestic Violence with Movement. We're continuing the Maid highlight series. And tonight's episode, we will discuss sea glass. This is episode 3, and the episode is called Sea Glass. Topics that I want to highlight on is mental health versus mental illness and bipolar disorder. Very good episode. The actors were hella good. It was just very, very informative. So the first thing I want to talk about is mental health versus mental illness. And sometimes those things get confused a lot of times. I want to break it down and let you know that it is separate. They have two different meanings. So what is mental health? Mental health consists of emotional, psychological, and social well-beings. This components affects how we think, how we feel, how we act, and how we manage stress, how we relate to other people, and how we make choices. So again, the key components on how we function within our lives are emotion, psychological, and social well-being. Other important factors that we really need to highlight and focus on when it comes to mental health is how we think, how we feel, and how we act. I can't stress that enough, especially when it comes to stress, how we relate to others, and the choices that we make. So mental health is very important stage in every person's life, from childhood to adolescence through adulthood. And I'll read that last part again, because some people think, mental health is an adult thing, and it really doesn't matter if you're a child, if you're an adolescent. You really have to deal with mental health when you're adult. That's not true. That is a lie. So this last part, please take notes and hear me clearly. Mental health is important in every stage of life. From childhood, mental health is important. From adolescence, it's definitely important. And then also through adulthood, okay? So what is mental illness? Mental illness or mental disorders is a wide range of mental health conditions that affect your mood, thinking, and behavior. Examples of mental illness would be depression, anxiety disorders, schizophrenia, eating disorder, and addictive behavior. So you guys, I hope you understand, you see the difference between mental health and mental illness. So if your mental health is really bad and it's not really looked at and it's haywire and all over the place and left untreated, comes a disorder. And again, the disorders are depression or anxiety disorder, schizophrenia, eating disorder, and addictive behavior. And the main components of these, how mental health conditions, the illness, it affects your mood, your thinking, and behavior. So again, 3 things that will affect mental illness. It affects your mood, your emotions are all over the place, it's unstable, your thinking, you have these irrational negative thoughts, and your behavior, how you think is how you act. So you may act violent, you may be withdrawn all the time, you don't want to talk to anybody, become really antisocial. So again, it affects the mood, thinking, and behavior, and this is mental illness. What are the symptoms of mental illness? So just to be clear, examples are feeling sad or down, confused thinking or reduced ability to concentrate, excessive fears or worry, or extreme feelings of guilt, extreme mood changes of highs and lows. Please remember that one, because that's what this episode really, really touched on. And I'm not giving any type of spoilers, but again, it does talk about mental illness. And one of the things that this actor did, it was just phenomenal. Extreme mood changes of highs and lows. Withdrawal from friends and activities is another symptom. Significant, tiredness, low energy, or problems sleeping, detachment from reality, delusions, paranoia or hallucinations, inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, problems with alcohol or drug use, major changes in eating habits, sex drive changes, excessive anger, hostility, or violence, suicidal thinking. So again, this is just a list of the mental illness symptoms. Again, bipolar disorder. What is that? So formerly it was called manic depressive illness or manic depression, but basically it is mental illness that causes dramatic shifts in a person's mood, energy, or ability to think clearly. So guys, here are the key words. It's a dramatic shift in number one, the person's mood, number two, the person's energy, and their ability to think clearly. Some good example of movies, if you really don't understand like the psychological jargon and you need examples or a visual of what bipolar looks like. Again, this episode is really good. Silver Lining Playbook. That was also an excellent movie. I really loved it. And just to see the character just displayed these types of disorders that he had with his thinking and his mood changing, his behavior. The Informant with Matt Damon, I hear that that's also a very good movie when it talks about bipolar disorder. So guys, what are the types of bipolar disorders? So there's type 1, type 2, and then there's, forgive me if I say this wrong, cyclothymic disorder. And you can correct me in comments if I really screwed it up. But type 1, it has episodes, type 1 bipolar disorder. So it's episodes of both mania and depression. I'm going to break that down and give an example of what that really means. But it deals with mania and depression. Depression is not necessary for a diagnosis, but a person has manic episodes and it must last at least 7 days or become so severe that you got to put that person in a hospital. So that's type 1 bipolar disorder. Type 2, a person experienced really depressive episodes shifting back and forth with hypomania, but never a full manic episode. So again, type 2 is more of this depressed, sad state. And the last one, cyclothymic. I think I did it right. Hey, disorder. The person is chronically unstable mood state. They can't control their emotions no matter what they do. They experience hypomania and mild depression for at least 2 years. So guys, if you know somebody who going through this and you notice some changes, it has to be 2 years of them just with this behavior. People with cyclothymia may have brief periods of normal mood, but these periods last less than 8 weeks. So that's something to be mindful of, okay? So what are the examples of being manic and depressive episodes? Manic, so feeling very up, high, elated, or it can be real irritable or touchy. Feeling jumpy or wired. Decreased need for sleep, loss of appetite, and you feel like they are unusual, important, talented, or powerful. So they have this, I like to call it alter ego. So again, they feel unusually important, like, you know, they're this big time superstar, Kim Kardashian or a Kanye West or LeBron James, like all of a sudden they just have this elated personality burst. They're talented. They can do anything. They're like this, the Banks artists. They can go and they can paint like these beautiful art pictures all over the walls, and they think that they're famous. Or they're like this famous tap dancer, like Gregory Hines. Like Gregory Hines have really just embodied them, and all of a sudden they're taking up tap dancing, and they want to go to like these talent shows like America Got Talent, and they just want to show off what they can do. So again, they feel like they're this unusual, important, talented, or powerful. That was an exaggerated example, but again, I just wanted to describe what a manic state is and just give you a visual. Depressive episodes, they feel very sad, down, empty, worried, or hopeless. They have trouble concentrating or making decisions. They feel unable to do even the simplest task. Okay, so that is examples of manic and depressive episodes. So I did not tell what this episode about, but there are certain topics that highlighted and did a very good job of these topics. Guys, thank you so much. Please email me. Again, I have a upcoming course that deals with domestic violence movement and how movement can be used as therapy to deal with trauma. So my email address is awilliam4000@gmail.com. Thank you for tuning in and be prepared this week to see episode 4. Take care, and guys, love you much. Take care. Bye-bye.